Hi folks, Dr. Mark Simpson here. Let's talk about the addiction cycle. This cycle starts with the first drink. Once the alcoholic has his or her first alcoholic beverage or drug of choice, it starts a craving for another and another and another and another. This results in a binge. Sometimes during or after the binge, there may be a number of negative consequences that may result in some of the following problems: blackouts, loss of employment, financial problems, conflicts with family members, anger, rage, injuries, hurting others, being victimized, and or getting arrested. For the alcoholic addict, their substance use is frequently involved in serious offenses. Offenses that include robberies, domestic violence, sexual assaults, physical assaults, and homicide. For the alcoholic addict, these type of negative consequences may result in the development of anxiety, depression, suicidal ideations, suicide attempts, and completed suicide. This is the percentage of deaths by suicide that involve opiates, including heroin and prescription pain pills. The percentage of those who attempt suicide under the influence of alcohol and or drugs but live through the suicide attempt is significantly higher. Many alcoholic addicts will have negative consequences in their life, but many may not be able to connect the dots and see how their substance use is the cause for their life problems. Someone who lacks insight into the problematic nature of their substance use will almost certainly repeat the addiction cycle, often until they are incarcerated, hospitalized, or die from an accidental or purposeful overdose. Often at some point, for those who survive what I just talked about, he or she may analyze the negative consequences of their substance use. And sometimes there becomes a moment of clarity. In the recovery rooms, this is sometimes termed a rude awakening. In the mental health field, this is termed insight. After going around the addiction cycle for a while, sometimes for years, sometimes for decades, the alcoholic addict is able to connect the dots to see how his or her substance use is causing dysfunction in their life. Usually, they become sick and tired of becoming sick and tired of their use. And they say to themselves, no more. This is often termed hitting bottom. This is usually followed by a sincere commitment to discontinue their substance use. However, inevitably, he or she will be presented with a trigger that creates a strong desire to have their substance of choice. Sometimes the individual will remain clean or sober for a week, a month, or more, and then convince themselves that their substance use is no longer a problem, and that they can safely have one alcoholic beverage or one hit from the pipe without any difficulty, and then stop. However, once the alcoholic gives in to their first use again, the craving for another kicks in, and the cycle repeats itself. There is good news and bad news. There are two ways to permanently break the addiction cycle. One is through a strong commitment to their recovery, and the other is through Let's hope the right choice is made. I hope you found this short presentation informative. If you did, please give me a like. And if you're interested in topics like this that may include the different type of triggers, what are the different types of substance abuse treatment programs, why do people relapse, and topics like depression and suicide, click the subscribe and the notification button. That way, when I put out a new video, you will be notified. Thank you for following me. Take care and be safe.